Hi, my name's Cole. I'm going to be your student nurse today.
Hi, Cole.
Providing for privacy. So, Betty, how are you doing today?
I'm fine.
Alright, can you tell me your full name and date of birth, please?
Betty Jones, 5/21/1952.
Alright, Betty, that matches the order that I have here. So, we were taking a look at your lab values today, and it looks like your hematocrit and hemoglobin's a little bit low, so we're going to be giving you a blood transfusion. Some of the associated risks with that are a transfusion reaction. You could have some flank pain, chest pain, nausea, chills, vomiting, diaphoresis. Is there any questions that you have with that?
No,
Alright, and do you consent to this?
I do.
Alright, cool. It looks like both you and Dr. Avery have signed this. Alright, next I'm going to just be checking the patency of your IV here. Alright, it looks like you're all good. So Betty, fun fact for you, we're going to be giving you normal saline along with your red blood cells. It's actually the only IV fluid that you're able to administer with blood. And if you were a little bit older or a little bit younger, we do a few different things. So if you were a kid, we'd make sure that your mom was in the room with you or your dad. And then if you were an older adult, we might use a different size needle. And it does look like you have a 20 gauge in, which is compatible with blood product administration. Alright, next, normal saline. The end of that did touch the table, but it's okay because the cap is on. And now I'm going to spike the bag using sterile technique. I'm going to compress the drip chamber, and with this blood product that we're administering, it does have a filter in it. It's all the way to the top, so it's above the filter here. Alright, and it does look like we're good to go. Flush the line. Alright, line is clear of any air bubbles. Alright, next I'm going to call lab. Lab? Can I please get some blood?
Here you go. Here you
Alright,
go. Yeah.
thank you. Okay, right away upon getting this blood, it's only good for 30 minutes. We can't administer it after that. I'm also going to invert the bag, check for any clots or extraneous solution, and I have my second nurse to confer with me. So medical record number is 224466. Location is HLRO, account number is 123456. Patient name is Betty Jones. Her red armband number is 456654, 456654. She is a blood type of B positive, donor pool number is 7890. The units in the pool are 4. Our volume is 250 mils. Blood transfusion that she's getting is packed red blood cells. The expiration date and time is 6/25/2021. 2000, and then the donor blood type is O positive. Compatibility test was completed. The date is 6/25/2021. The sanction number is 1. Is all this information accurate?
It is all correct.
Alright, thank you.
Yep.
And in case of an adverse reaction, you would notify the provider, stop the infusion before we did anything else, and also call pharmacy for proper procedures. And before I give this to Betty, I'm just going to take some vital signs and then do a cardiac and respiratory assessment. Alright, everything's all good. Also know that those vitals will be done within 15 minutes of administering the blood. So obviously you wouldn't want to open the line up like that. I kinked it so it's okay. I'm going to close that again, and then I'll re-spike the bag. Alright, bag was spiked. Now I am closing the saline line so it can't intermix with the blood. Okay, blood is all good to go. We're going to hang that. And then we are going to start flushing the blood, but being careful not to waste any. Alright, we are all good to go. Saline is closed, blood is open, roller clamp is locked. Second thing that I am going to do here is get this started on your body. Cap was removed. IV is open, but it is not infusing into the patient since everything is still locked. Alright. Alright, so now we are going to program the blood to infuse at the rate of 50 mils an hour. And then I'm going to infuse the volume at 225 out of this 250 ml bag so that my line doesn't run dry. Alright, 50, 225. Start. Open up the roller clamp. Alright, and it is infusing. Alright, so I'm going to let the infusion run its course, then after that is all completed, I am going to pause it, close the blood line, open up the saline line, and then proceed to flush the blood right out and end it with the saline. Now I am going to get my patient all disconnected. Please note that I did stay with her for 15 minutes during this process to monitor for any transfusion reactions. Betty was great, she handled it like a champ. Alright, roller clamp is closed. Supplies are disconnected. Everything is disposed of. I am getting rid of my gloves, performing hand hygiene again. I'm taking a baseline set of vitals after 15 minutes, doing my cardiac respiratory assessment again, then repeating that at 15 or 30 depending on agency policy. I am going to make sure that everybody's comfortable, safe, and then I am just going to document the date and time, the location of the venipuncture site, the amount of blood that was transfused, the kind of blood, and how the client handled it. Client is safe, performed hand hygiene, documented. That'll be all. Thank you.